everyone, and welcome back for another deep dive. Today, we are going to be tackling the world of psychiatric diagnoses.
Ooh, that's a big one.
Yeah, it is. And to help us out, we've got a whole stack of research here, mostly from that comprehensive handbook of personality and psychopathology.
Lots to unpack there.
Definitely. So get ready to explore how we classify mental health conditions, where these systems came from and all the debates surrounding them.
Sounds good.
Yeah.
And it's a journey that goes way back, further than most people would probably guess.
Okay, you're going to have to give me a historical fun fact now. I love those.
Well, did you know that even Hippocrates, back in ancient Greece, was trying to categorize mental illness?
Wow, really?
Yeah, I mean, obviously what he was doing back then was pretty basic compared to how we do things now.
That's understandable.
But it shows how long we've been trying to understand, what we now call mental illness.
So even back then, they were trying to move beyond just labeling everyone as, mad or crazy.
Exactly. They were already looking for patterns of behavior and symptoms. It was a very early form of diagnosis.
That's pretty amazing.
Yeah, and that actually brings us to a really important figure, Paracelsus. He was the one who really promoted this idea of syndromal diagnosis.
Syndromal diagnosis.
Yeah.
Okay, I'm intrigued, but need a bit more explanation here. What does that even mean?
So imagine, right, you're a doctor, and you start noticing certain symptoms kind of always show up together.
Okay, yeah.
Let's say someone comes in feeling deeply sad all the time. They're always tired, no energy, and they've lost their appetite.
Right. Classic signs of depression, it sounds like.
Right, and Paracelsus had this big idea. He said, this group of symptoms, this syndrome, it points to a specific type of, mental distress, we'd say now. It was huge, moving away from just seeing everything as one big, scary mental illness to recognizing distinct, conditions.
Ah, so it's like connecting the dots, seeing how these symptoms relate to a bigger picture.
Exactly. And you know what? It's like detective work, in a way.
I like that analogy.
And this approach, this detective work, was taken even further by Karl Kahlbaum and Emil Kraepelin.
Those names ring a bell.
They focused on classifying these illnesses based on their how they develop over time and the outcomes.
Okay, and how'd that change things?
Their work laid the groundwork for how we do diagnosis now, with the DSM.
Ah, the DSM, the Diagnostic and Statistical Manual of Mental Disorders. Every mental health professional's go-to guide, right?
Exactly. But here's the thing a lot of people don't realize. Before we got to the DSM-3, which came out in 1980, diagnosis was all over the place.
Wait, really? What do you mean?
Well, there was this famous study, the Rosenhan experiment, that showed just how subjective and unreliable diagnoses were back then.
Unreliable? You mean different doctors could assess the same patient and come up with totally different diagnoses?
Yeah, that was a real problem.
I can see how that'd be an issue.
It made research so hard, And then even just deciding on treatment was tricky. How do you choose when the diagnosis isn't even consistent? And don't even get me started on how mental health professionals could barely communicate because everyone was saying different things. The DSM-3 really aimed to fix all that.
So what did the DSM-3 do differently? What was so revolutionary about it?
It brought in this idea of specific, observable criteria for each disorder. Think of it like a checklist.
Okay, I'm starting to see how that helps.
Instead of just relying on gut feelings, clinicians could use this standardized system to make the diagnosis.
So it was about trying to be more objective, take some of the guesswork out of the process.
Exactly. And that had a ripple effect on research, too. Because now everyone was on the same page, using the same terms. Scientists could study, specific disorders much better and compare findings from different studies. It really moved the field forward.
I can definitely see how that would lead to a boom in research. But this all makes me wonder, is diagnosis just a matter of, ticking off symptoms on a checklist? Is that all there is to it?
That's a really great question, and one that researchers are still debating and figuring out. You're right, that checklist is super important, but it's about identifying those surface-level symptoms. There's way more going on underneath,
Right, those hidden layers we talked about. I love getting to the bottom of things.
I knew you would. So think of it like this. You're not just looking at the symptoms themselves. You're trying to figure out what invisible forces might be causing those symptoms, like personality traits or genetics or how someone's environment has shaped them. It's what makes each person unique, really.
So it's like those detective shows, they don't just focus on the crime scene, right? They investigate the suspect's past, their motives, all their relationships.
That's a perfect analogy. You're trying to piece together the puzzle of their mental health, basically.
Yeah.
And this is where the idea of latent constructs comes in.
Latent constructs. Okay, that sounds pretty technical. Break it down for me.
Sure. Think of them as these underlying dimensions of personality and behavior.
Okay.
You can't observe them directly, but they contribute to a lot of different mental health conditions, like someone's level of neuroticism, or how impulsive they are, or even how sensitive they are to stress. These are all examples of latent constructs.
So it's like these invisible factors are pulling the strings behind the scenes, influencing how the symptoms actually show up.
Exactly.
Yeah.
And researchers have all sorts of fancy statistical methods to try and untangle how these things are related, all these complex relationships. One of the most powerful tools they use is something called structural equation modeling, or SENG for short.
Same. Okay, gotta be honest. Statistics are not my strong suit. Can you give me an analogy? Something a non-statistician like me can grasp?
Uh-huh. Okay, let's try this. Imagine you're trying to figure out how depression and being impulsivity are related. The HEM is like, it lets you see all the possible connections between those two things. Not just a direct connection, but all the indirect ones too. Through things like genetics, maybe stressful life events, social support, all of that.
So it's not just about saying, oh, this person is depressed, A&D impulsive. It's about figuring out all the connections, the hows and whys of what's going on in their mind.
You got it. It's like having this super-powered magnifying glass to see all the intricate workings of the mind. And this brings us to another piece of the puzzle, a really important one, the interplay between our genetics and our environment.
The nature versus nurture debate. Had a feeling we couldn't avoid that one. To be honest, I'm still kind of fuzzy on how genes actually influence mental health.
Yeah, it's definitely not as straightforward as saying this one gene causes this one disorder. It's more about genes creating vulnerabilities, like a predisposition to certain things.
Okay, so walk me through that.
Let's say you inherit a gene that makes you more sensitive to stress than the average person.
Okay, I can see how that might be a problem.
Right, but it doesn't automatically mean you're going to get an anxiety disorder, right? Whether that actually happens depends on, well, everything you experience in life, your coping skills, how much stress you actually encounter, all of that.
So genes aren't destiny. They're not setting everything in stone, but they do play a role like shaping the landscape of our mental health.
Exactly. And here's where things get even wilder. Some genes might actually influence the types of stressful events we encounter.
Wait, seriously? How is that even possible?
Yeah, it's crazy, right? It's like a mind-blowing feedback loop. Let's say someone has a gene that makes them more impulsive.
Okay, I can see where this is going.
They might be more likely to make risky decisions, which then leads them to experience more stressful events like, I don't know, financial problems or relationship drama, things like that.
Wow, so our genes aren't just shaping how vulnerable we are, they're actually influencing the environment we end up in.
Exactly. It's a constant back and forth between nature and nurture. A super complex interplay that makes each person's experience with mental health totally unique.
That's incredible. But you know what? There's another layer of complexity here that we haven't even talked about, the influence of culture and society.
You're right. We can't just pretend everyone experiences mental illness in the same way. Culture shapes so much of how we view the world, including how we see mental health. So how does all that play into diagnosis?
Exactly. It seems like that must make things really tricky.
It does. Researchers are still trying to figure it all out. One of the biggest challenges is that there isn't even like a universally agreed on definition of what culture and ethnicity mean. It makes research so difficult because how can you isolate the effects of something if you can't even agree on what that thing is?
So it's like trying to study something without even knowing what you're measuring. How can you compare apples to oranges if you don't even know what an apple is?
Exactly. But even with all these challenges, there's some really interesting research that shows how cultural factors can definitely influence diagnosis. Like, for example, the ECA study, that's the epidemiologic catchment area study, it found that the rates of certain disorders were actually pretty different across racial and ethnic groups.
Okay, this is getting really interesting. What kind of differences did they find?
For instance, they found that white individuals were more likely to be diagnosed with things like depression and anxiety disorders. But black individuals, on the other hand, were more likely to get diagnosed with phobias.
Wow, those are pretty significant differences. It really highlights the need to consider culture when we're thinking about mental distress.
Absolutely. And it's not just about translating diagnostic criteria into different languages. That's not enough. It's about recognizing that different cultures might have entirely different ways of understanding mental health and illness.
It's like a totally different framework for thinking about it.
Right. So it's not just about fixing the system we have now. It's about fundamentally rethinking how we approach diagnosis. It needs to be sensitive to all this cultural diversity. And actually, this brings to mind another huge social factor that's got to be impacting mental health. Socioeconomic status, you know, SES.
See, yes, the elephant in the room. It's pretty clear that poverty and social inequality can have a huge impact on mental health. But what's the relationship there? Is it that poverty contributes to mental health problems, or do mental health problems lead to poverty?
That's a classic question, isn't it? Like, which came first, the chicken or the egg?
Aha, exactly. But my guess is it's not a simple either-or kind of answer.
You're right, it's not. It's more like this vicious cycle, unfortunately. We know that folks living in poverty deal with way more stress, more trauma, and they often don't have access to the resources they need, you know? All of that can increase the risk of developing mental health issues.
Yeah, that makes perfect sense.
But then, the flip side is also true. If someone has a serious mental illness, it can make it so much harder to hold down a job, to find stable housing, to basically climb out of poverty.
It's like a double whammy.
It is. And it's this complex interplay that we really need to address from, like, all angles.
Okay, so we've covered how historical factors and social and even cultural factors have all shaped our understanding of psychiatric diagnosis. But we can't forget one crucial piece: the mind-body connection.
Oh, absolutely. You can't just focus on the brain and ignore the rest of the body. The mind and body are constantly talking to each other. They influence each other in ways we're just starting to understand.
I love that idea that the mind and body are so interconnected. Can you give me some concrete examples of how this connection actually plays out in mental health?
Sure. Think about stroke patients, for instance.
Okay.
Sometimes after someone has a stroke, they develop depression or other psychological symptoms.
Oh, wow.
And that's because damage to certain parts of the brain can directly affect, your mood, your thinking, your behavior, everything, really.
That's a powerful example of how a physical change in the brain can have such a direct impact on mental health.
And it goes the other way, too. Your mental state can affect your physical health, like chronic stress, for example.
I've definitely heard that stress can be a killer.
Yeah, for real. Chronic stress weakens your immune system, increases the risk of heart disease, and just contributes to so many physical problems.
It's like that old saying, a healthy mind and a healthy body.
Right. They really are interconnected. This whole thing makes me think about the idea of a transactional feedback loop. Can you explain that one for our listeners?
I'm all ears.
It's the idea that your thoughts, feelings, behaviors, and even your physical sensations are all constantly feeding back into each other. So imagine you're feeling super anxious.
I can relate to that, unfortunately.
Yeah, I think most of us can these days. So when you're anxious, you might notice some physical symptoms, like your heart racing or feeling like you can't breathe. But then those physical sensations make you feel even more anxious, and it just keeps escalating.
Oh, yeah. I know that feeling. It's like a snowball effect where things can get out of control really fast.
It is. And that's why it's so important to approach mental health in a holistic way. You got to consider all the different pieces: biological, psychological, social, even spiritual. It all plays a role.
This has given me such a new appreciation for how complex diagnosis and treatment really are. It's not about finding a magic pill, that's for sure.
Nope, not at all.
It's about understanding each person's unique story and all the factors that have shaped their experience.
Couldn't have said it better myself. And this actually brings us to another fascinating part of our journey: how our understanding of mental illness has changed the way we approach treatment, from the very early days of asylums to the more modern evidence-based approaches we have now.
Oh, yeah. I know things used to be really bleak for people with mental illness. How did we get from asylums to the types of treatment we have today?
Well, it's been a long and winding road for sure, but thankfully, things have changed so much for the better. Back in the day, people with mental illness were basically outcasts. They were feared and often locked away in asylums where treatment was a lot of times inhumane and completely ineffective.
Yeah, that's a really dark part of history when it comes to mental health care. What prompted the shift to more humane and effective treatment?
Well, a lot of things happened at the same time, really. We started to understand the brain better, new medications were developed, but there was also like this growing social understanding that psychological and social factors contribute to mental illness.
So it was like a perfect storm of scientific progress and increased compassion.
Yeah, I like that. It's a great way to put it. And that paved the way for the rise of evidence-based practices, which are basically treatment approaches that have been rigorously studied and proven to be effective.
So it's not just about relying on intuition or what's always been done anymore. It's about using treatments that actually have scientific backing.
Exactly. And that shift has revolutionized mental health care.
Yeah.
We now have so many more therapeutic options, from different types of psychotherapy to medication to even lifestyle interventions. And the key is figuring out what works best for each individual.
Hmm.
But I think it's time we moved on from these general concepts and started talking about some specific disorders and how our understanding of them has evolved over time. What do you think?
I'm all for that. Hit me with some of those aha moments you promised. I'm ready for some specifics.
Uh-huh. All right, get ready for a fascinating journey into some of the most common and often misunderstood mental health conditions. Let's start with generalized anxiety disorder, or GAD for short.
GAD, the disorder where worry takes center stage. But is it just everyday worries, or is there something more to it than that?
Oh, it's definitely more than just your average worries. People with GAD, they experience this excessive worry that can feel impossible to control. And it's not just about one specific thing. They might worry about work, money, their health, relationships, even just small everyday things.
So it's like this constant nagging sense of dread that just follows them around.
Exactly. And it can really affect their lives. People with JD often feel overwhelmed by their worries, and it can mess with their sleep, their concentration, and just their overall quality of life.
It sounds exhausting, frankly. This makes me wonder about the root of GED, what causes it. Is it purely psychological, or are there biological things going on too?
Well, like most mental health conditions, it's a mix of different factors. Research tells us that genetics definitely plays a role. About 30% of the variance in GAD is because of what people inherit.
So some people are just born with a tendency to be more anxious, like they've got this heightened sensitivity to worry.
Yeah, that's the general idea. But, and this is super important, genes aren't destiny. It's always this interplay. So that genetic vulnerability interacts with things in your environment, like stressful events, maybe stuff that happened in your childhood. All of that can contribute to developing GAD.
So it's not nature or nurture. It's this a complex dance between the two, right? This makes me wonder about treatment. Are there effective approaches for GAD that take both of those things into account? The biological and the psychological.
There are. One of the most effective approaches is cognitive behavioral therapy, or CBT. Have you heard of that one?
Oh, yeah, CBT is pretty well known. It's all about challenging those negative thoughts and learning new coping mechanisms, right?
You got it. When it comes to GAD, CBT focuses on helping people learn how to identify and challenge those thoughts that trigger their worry. They learn relaxation techniques and how to gradually face their fears.
So it's like giving them a toolbox for managing their anxiety, helping them regain control of their lives.
Exactly. And while CBT is usually the first line of treatment, there are also medications that can help. Antidepressants and anti-anxiety meds can be really effective at reducing those GAD symptoms.
So it's not always an either-or situation. Sometimes it's a combination of both therapy and medication that works best.
Right, and it's important to remember that everyone's experience with GAD is different. Treatment really needs to be tailored to each individual's needs.
I think that's a key takeaway for all mental health conditions, really. There's no one-size-fits-all approach.
Absolutely. And speaking of unique journeys, let's shift gears for a minute and talk about a disorder that often gets misdiagnosed: bipolar disorder.
Bipolar disorder, the one with the extreme mood swings, right? But I'm guessing it's a bit more complicated than that simple description.
You're right. There's so much more to bipolar disorder than just having mood swings. It's about these distinct episodes of either mania or hypomania that alternate with episodes of depression.
Okay, so break it down for me. What exactly are mania and hypomania?
Mania is this state of super intense energy.
Hmm.
Like, people feel euphoric, impulsive. They might feel invincible even.
Wow, that sounds intense.
Yeah, it can be. Their thoughts race. They might talk nonstop. They might even do risky things without thinking about the consequences.
So it's like being on this emotional roller coaster, but with the potential for some real-life consequences if they're not careful.
Exactly. Now, hypomania is similar to mania, but it's not as severe, and it doesn't usually disrupt their everyday life as much.
So it's like a milder form of mania. But this brings up a question. If bipolar disorder involves both those manic or hypomanic episodes and depressive episodes, why does it get misdiagnosed so often?
It often gets mistaken for what we call unipolar depression, especially if someone's going through a depressive episode and they haven't had a full-blown manic episode yet.
Ah, that makes sense. If they're just showing signs of depression, it's easy to miss the bigger picture. But I bet that misdiagnosis could have some pretty serious consequences, especially when it comes to treatment, right?
Oh, for sure. Treating bipolar depression with just antidepressants, without mood stabilizers, can actually trigger a manic episode. So getting the diagnosis right is absolutely crucial. It can literally be the difference between helping and harming someone.
It's a stark reminder that seeking help from qualified mental health professionals is so important. They're trained to look for these nuances and make sure people get the right diagnosis and the right treatment.
Absolutely. And since we're talking about treatment, let's talk about some of the main approaches to managing bipolar disorder.
I know medication is often a big part of treating bipolar disorder, right?
Yeah.
What are some of the meds that get prescribed most often?
Usually the first line of treatment for bipolar disorder is what we call mood stabilizers. Lithium is a classic example. They help to regulate mood and prevent both those manic and depressive episodes from happening.
Yeah, lithium's like the go-to mood stabilizer. I've heard that a lot. I've also heard of anticonvulsants and antipsychotics being used for bipolar disorder. Why are those prescribed sometimes?
Yeah, those could be really helpful too. They can help manage both the manic and depressive episodes. It really depends on the person,
Hmm.
what their specific symptoms are, their medical history, how they react to different medications. It's very individual.
It's about finding the right combination for each person, not just a one-size-fits-all approach. But I have to imagine that medication alone isn't enough to manage a condition like bipolar disorder, right? What role does therapy play in treatment?
Therapy is absolutely essential. It's not just about meds. Psychotherapy alongside medication can make a huge difference.
Okay, so what kinds of therapy are usually recommended for managing bipolar disorder?
Two that have a lot of research supporting them are cognitive behavioral therapy, CBT, and interpersonal and social rhythm therapy. That one's often shortened to IPSRT.
Okay, I'm familiar with CBT, but what's IPSRT all about?
So, CBT helps challenge those unhelpful thoughts and build coping skills. IPSRT, on the other hand, is all about regulating those sleep-wake cycles. It helps people establish consistent routines because having that rhythm is really important for managing bipolar disorder.
So it's about bringing stability to their daily lives, both in terms of their thoughts and their routines.
Exactly. And these therapies can really empower people with bipolar disorder, give them the tools and strategies they need to manage their condition and live full and meaningful lives.
It sounds like finding that balance, between the right medication and the right therapy is key to navigating the ups and downs of bipolar disorder.
You're absolutely right. It's not easy. But with the right support, it's definitely possible to thrive with bipolar disorder. And actually, this might be a good place to shift our focus to a disorder that's often surrounded by misunderstanding and stigma. Schizophrenia.
Schizophrenia, it's a word that gets thrown around a lot, but I think a lot of people don't really understand what it is. For starters, we got to debunk that myth that schizophrenia means someone has split personality. That's just not accurate, right?
Yeah, that's a huge misconception. Schizophrenia isn't about having multiple personalities. It's much more complex than that, affecting how a person thinks, how they perceive the world, their emotions, their behavior, everything really.
So if it's not about multiple personalities, what does schizophrenia actually look like? What are the main symptoms?
Schizophrenia involves a whole range of symptoms, and they can be different from person to person. But the most common ones fall into two categories: positive symptoms and negative symptoms.
Okay, I'm curious about that distinction, positive and negative symptoms. What do those terms mean when we're talking about schizophrenia?
Positive symptoms are basically things that are added to someone's experience, things that wouldn't normally be there. Hallucinations and delusions are two of the most common positive symptoms of schizophrenia.
So hallucinations are things like hearing voices or seeing things that aren't actually there, right? And delusions are those really strong false beliefs.
Exactly. Someone with schizophrenia might believe they're being followed or persecuted, or that they have some kind of special power, things like that. These delusions can be incredibly distressing, and it's really hard for them to let go of those beliefs, even when you show them evidence that contradicts them.
It sounds incredibly difficult to live with, to be honest.
Hmm.
And what about the negative symptoms? How are those different from the positive ones?
Negative symptoms are kind of the opposite. They're about things that are taken away from someone's experience.
Okay, I'm following.
These can include things like apathy, not feeling much of anything, withdrawing from social situations, lacking motivation, and even having trouble experiencing pleasure. It's like their emotional and social world gets muted.
So it's like a dimming or a flattening of their usual emotional responses.
Exactly. And it's the combination of these positive and negative symptoms that makes schizophrenia such a challenging and complex disorder.
I'm starting to get a much deeper understanding of what schizophrenia really is. It's definitely not what I always imagined. It's not about split personalities or evil intentions. It's about real people struggling with a very real illness that affects their thoughts, their feelings, their ability to function in the world.
That's a great way to put it. And while it's a serious and chronic illness, there is definitely hope. Effective treatments are available, and with the right support, people with schizophrenia can absolutely live fulfilling lives.
I'm glad to hear there's hope. But before we jump into treatment, let's rewind a bit and talk about what causes schizophrenia. Is it purely genetic, or are environmental factors involved too?
Well, the causes are complex, and we're still figuring a lot out, but we know that it's not just one thing, that's for sure. It's likely a combination of genetic factors, abnormalities in the brain, and things in the environment that can act as triggers.
So it's another one of those nature and nurture situations where multiple things are interacting to make someone more vulnerable.
Exactly. Genetics definitely play a role, but it's not as simple as inheriting a single schizophrenia gene. It's more likely that multiple genes are involved, and they interact with each other A and D with environmental factors to increase someone's risk.
This makes me think about the role of stress and trauma in mental health. Could those be some of those environmental triggers you're talking about?
They definitely could be. Research suggests that if someone experiences a lot of stress or trauma, especially during their childhood or teenage years, that can increase their risk of developing schizophrenia, especially if they're already genetically predisposed.
So it's like those environmental factors can act as this catalyst, pushing someone who's already vulnerable over the edge.
That's a good way to think about it. But it's important to keep in mind that not everyone who experiences trauma or have a family history of schizophrenia will develop the disorder. There are other things that can protect people, like having a strong support system, healthy coping skills, and access to good resources. All of that can make a difference.
This is highlighting just how complicated mental illness really is. It's never just one thing, right? It's about all these factors, genetics, environment, personal experiences, and how they all come together in each individual's life.
Couldn't have said it better myself. And this leads us to a really important question. Are there treatments for schizophrenia that address all those different layers of complexity? Can we actually help people with this condition?
I'm really eager to hear about treatment options, especially because schizophrenia is often portrayed as this hopeless and untreatable condition. What are some of the most effective ways to help people with schizophrenia?
Well, thankfully, we do have effective treatments, and the outlook for people with schizophrenia is way better now than it was in the past. Antipsychotic medications are usually the cornerstone of treatment. They're really good at reducing those psychotic symptoms like hallucinations and delusions.
So the meds can help quiet those distressing positive symptoms, those things that are added to their experience. But I'm guessing medication alone isn't enough to deal with all the challenges of schizophrenia.
You're absolutely right. Medications are essential for managing those acute symptoms, but they're not a cure-all. Therapy is also super important. It can help people with schizophrenia develop coping skills, manage their daily lives, and build a support system.
Okay, so what kinds of therapy are most helpful for people with schizophrenia?
There are a few types that research shows are beneficial. Cognitive behavioral therapy, CBT, which we talked about before, can help people challenge and manage their delusions and hallucinations. And then there's social skills training, which can help improve their communication and how they interact with others. And family therapy can be really important too, to provide support and education for families dealing with a loved one's schizophrenia.
It sounds like it's about taking a multi-pronged approach, addressing the biological, the psychological, and the social aspects of the disorder.
Exactly. And with the right combination of medication, therapy, and support, people with schizophrenia can live full and meaningful lives. It's not a given, but it's definitely possible.
This is giving me a much more hopeful perspective on schizophrenia. It's not a life sentence, it's a challenge, but a challenge that people can learn to manage.
I'm glad to hear that. And speaking of challenges, let's switch gears again and talk about a group of disorders that often fly under the radar, but can be just as debilitating. Personality disorders.
Personality disorders. I think there's a lot of confusion and stigma surrounding these conditions. What exactly are they, and how are they different from other mental illnesses?
You're right, personality disorders are definitely misunderstood and often stigmatized, but they can have a huge impact on people's lives and relationships. They're basically these enduring patterns of thinking, feeling, and behaving that are really different from what's considered normal in their culture. And these patterns cause significant distress or make it hard for them to function well in life.
So it's not just about having a quirky personality or being a bit eccentric. It's about these ingrained patterns that are inflexible and cause problems in relationships, work, or just everyday life.
Exactly. And there are actually a number of different personality disorders, each with its own unique set of characteristics.
Like, for example, I've heard of borderline personality disorder, or BPD. It's often portrayed in the media as being dramatic and manipulative, but I'm guessing there's more to it than that stereotype, right?
Oh, for sure. There's so much more to BPD than that stereotype. It's a really complex disorder characterized by intense emotions, unstable relationships, a huge fear of abandonment, and impulsive behaviors.
So it's not about being intentionally manipulative. It's about struggling with these really overwhelming emotions and a deep-seated fear of rejection.
Exactly. And people with BPD are often in a lot of emotional pain. They're just trying to cope with those really intense feelings, and it can manifest in ways that other people find difficult to understand.
That makes a lot of sense. And what about other types of personality disorders? I've heard of narcissistic personality disorder, which seems to be getting a lot of attention these days. What exactly is that? Yeah, it seems like that one's always in the news. What's the deal with narcissistic personality disorder?
Well, it's characterized by this really grandiose sense of self-importance, a need for constant admiration, and a real lack of empathy. People with narcissistic personality disorder often have this inflated view of their own accomplishments and talents, and they can be super sensitive to any kind of criticism.
So it's not just about being vain or self-centered, it's deeper than that. It's like they truly believe they're superior to everyone else and they deserve special treatment all the time.
Exactly. And that sense of entitlement can create a lot of problems, especially in relationships, because they often end up exploiting others to get what they want.
That sounds like a recipe for disaster, to be honest. Are there other personality disorders that we should be aware of?
There are a few more. One that's pretty common is obsessive compulsive personality disorder, or OCPD. It's important not to confuse this one with obsessive compulsive disorder or OCD, which is different.
Right. I know OCD involves those intrusive thoughts and compulsive rituals like excessive hand washing or checking things repeatedly, but what's the difference with OCPD?
So with OCPD, it's more about this preoccupation with orderliness, perfectionism, and control. Someone with OCPD might be totally devoted to their work, like to the point where they neglect their hobbies, their relationships, everything else. They can be super rigid in their thinking, and they often have a hard time delegating tasks to other people.
So it's not just about being neat and organized, it's this deep-seated need to be in control, to make sure everything's perfect, and to avoid making any mistakes.
Precisely. And that need for control can seep into every area of their life, which causes a lot of stress and problems in their relationships.
It sounds like all these personality disorders can create significant challenges for individuals and for the people around them. What are some of the treatment options available for these conditions?
Treating personality disorders can be tricky, and it often takes a long time because those personality traits are so ingrained. They can be really resistant to change. But there are effective approaches, and usually therapy is the cornerstone of treatment.
What types of therapy are generally recommended for personality disorders?
Well, the best type of therapy depends on the specific personality disorder and what the individual needs. But some of the commonly used approaches include dialectical behavior therapy, also known as DBT, psychodynamic therapy, and cognitive therapy.
I've heard that DBT is especially helpful for borderline personality disorder. What makes it so effective for BPD?
Well, DBT was actually developed specifically for treating BPD. It focuses on helping people learn to regulate their emotions, develop coping skills for managing distress, and improve their relationships with others.
So it's about giving them the tools to navigate those intense emotions and build healthier, more stable relationships.
Exactly. And for other personality disorders, like narcissistic personality disorder or obsessive-compulsive personality disorder, psychodynamic therapy and cognitive therapy can be really beneficial.
What do those therapies focus on?
So psychodynamic therapy delves into those underlying conflicts and patterns that might have developed way back in childhood, things that might be contributing to the personality disorder now. It helps people gain insight into their behavior and figure out healthier ways to relate to other people. Cognitive therapy, on the other hand, focuses more on the present. It's about identifying and challenging those distorted thoughts and beliefs that are driving those maladaptive behaviors.
So it's about recognizing those thought patterns that are keeping them stuck and helping them learn to think about themselves and the world in a more balanced and realistic way.
Exactly. And it's super important to find a therapist who specializes in personality disorders, someone who can really tailor the treatment to the individual's specific needs and challenges.
That makes perfect sense. Now, I think we need to talk about another category of disorders that often gets overlooked, but can be just as devastating: substance use disorders.
You're absolutely right. Substance use disorders are a huge problem, incredibly prevalent, and they can have truly devastating consequences for individuals, for families, for society as a whole.
Let's start by talking about alcohol use disorder, since that's one of the most common substance use disorders. What exactly is it, and how is it different from just drinking too much every once in a while?
Alcohol use disorder is a chronic relapsing brain disease. It's characterized by this inability to control alcohol consumption even when there are negative consequences. It's not just about having a few too many drinks at a party every now and then. It's about a pattern of alcohol use that starts to interfere with your work, your relationships, your overall well-being.
So it's about that loss of control, even when it's clear that the alcohol is causing problems in their life. What are some of the signs that someone might be struggling with alcohol use disorder?
There are quite a few red flags. They might find themselves drinking more than they intended, trying to cut back but not being able to, spending a lot of time either drinking or recovering from drinking, having strong cravings for alcohol, neglecting their responsibilities, continuing to drink even though it's causing problems, and developing a tolerance to alcohol, meaning they need to drink more and more to get the same effect.
Those are some pretty clear indicators that alcohol has become a problem. But I'm guessing there's often a lot of denial and shame associated with alcohol use disorder, which can make it hard to seek help, right?
You're absolutely right. The stigma is a huge barrier. People who are struggling with alcohol use disorder might feel so ashamed or afraid of being judged that they don't reach out for help. They might worry about what their family or friends will think, or even what their doctor will think.
That's so sad. It really highlights the need to create a more compassionate and understanding environment around substance use disorders. It's not a moral failing or a sign of weakness. It's a complex brain disease that often requires professional help to overcome. Speaking of help, what are some of the most effective treatments for alcohol use disorder?
Thankfully, there are a number of evidence-based treatments that can help. Individual therapy and group therapy can be really effective. They can help people understand why they're drinking, develop coping skills to manage triggers, and build a strong support system.
So it's about addressing the psychological and social aspects of addiction.
Exactly. And in addition to therapy, there are actually medications that can be really helpful. Some medications can help reduce those cravings for alcohol and make it easier to avoid relapsing.
I've also heard that support groups like Alcoholics Anonymous or AA play a big role in recovery for a lot of people.
Absolutely. AA is a really well-known and accessible support group that can be a lifeline for people recovering from alcohol use disorder. It provides a safe and supportive environment where people can share their experiences, connect with others who really understand what they're going through, and learn from people who have been there and successfully navigated the path to sobriety.
It's like a community of support where people can help each other stay accountable and get through those tough times.
Exactly. And I think it's important to remember that recovery is a journey, not a destination. There will be bumps in the road, ups and downs, but with the right support and resources, lasting recovery is definitely possible.
This is giving me a much more hopeful perspective on alcohol use disorder. It's not a hopeless situation. It's something that people can overcome with the right support and treatment. But we can't just focus on alcohol, right? There's a whole world of substances out there that people struggle with. Opioids, for example, have been making headlines in recent years because of the overdose crisis. What are some of the key things we should know about opioid use disorder?
Opioid use disorder is a really complex issue. And unfortunately, a lot of cases actually stem from legitimate use of prescription painkillers. But then, over time, people build up a tolerance and develop a dependence on those opioids, leading to this compulsive need for the drug. And that need continues even when it's no longer medically necessary.
So it's not just about people chasing a high. It can start with a real medical need and then spiral out of control. This makes me think about the stigma surrounding opioid use disorder. People often view it as a moral failing or a lack of willpower, but it sounds like it's a lot more nuanced than that.
You're absolutely right. The stigma is huge, and it prevents a lot of people from getting the help they need. People struggling with opioid use disorder might be so afraid of being judged by their family, their friends, even their doctor, that they don't want to admit they have a problem.
That's heartbreaking. We really need to shift our perspective and start viewing addiction with more compassion and understanding. It's a health issue, not a character flaw. So what about treatment for opioid use disorder? Are there effective approaches out there that can help people reclaim their lives?
Thankfully, there are. Medications like methadone and buprenorphine can be game changers. They can help reduce those intense cravings and manage the really difficult withdrawal symptoms, making it easier for people to engage in therapy and start building that solid foundation for recovery.
So it's not just about willpower. There are medications that can actually target those biological cravings and make recovery a more realistic goal.
Exactly. And just like with alcohol use disorder, therapy is a crucial part of the treatment plan. Cognitive behavioral therapy, CBT, can be really helpful here too. It can help people identify those triggers that lead to drug use, develop coping mechanisms to manage those triggers, and challenge those negative thoughts and beliefs that might be fueling their addiction.
So it's about tackling both the physical and the psychological aspects of addiction. This makes me wonder about other types of substance use disorders, like stimulant use disorder, which involves drugs like cocaine and methamphetamine. Are the treatment approaches similar for those?
While the specific medications used might be different, the overall approach is often pretty similar. For stimulant use disorder, we don't yet have medications that are as effective as methadone or buprenorphine are for opioids. But there are some promising medications being developed, and those behavioral therapies, like CBT, are still a cornerstone of treatment.
I can imagine that stimulant use disorder is particularly challenging to treat, given the intense highs and powerful cravings that come with those drugs.
You're right, it can be really tough. Stimulants basically hijack the brain's reward system, making it incredibly hard to break free from that cycle of using. But it's not impossible. Recovery is definitely possible, and with the right support and a comprehensive treatment plan, people can and do overcome stimulant use disorder.
This really highlights the importance of early intervention, doesn't it? The sooner someone gets help, the better their chances of recovery.
Absolutely. Early intervention can make a world of difference. It can prevent those long-term consequences of addiction and significantly increase the likelihood of lasting recovery. We need to do a better job of identifying substance use disorders early on, providing education and support, and making sure that treatment is readily available to everyone who needs it.
I completely agree. This whole discussion about substance use disorders has been incredibly eye-opening. It's clear that we need to move away from that old mindset of judgment and stigma and start embracing a more compassionate and understanding approach. We need to treat addiction as the health issue that it is. But before we move on, I want to circle back to something you mentioned earlier, that connection between mental and physical health. We talked about how stroke patients can develop psychological symptoms and how chronic stress can actually make us physically sick. Can we explore that mind-body connection a little bit more? It feels like a really crucial piece of the puzzle when it comes to understanding mental health.
You're spot on. The mind and body aren't separate entities. They're constantly interacting and influencing each other. And that interplay has a huge impact on our overall well-being.
I love that idea that we're not just minds walking around in bodies. It's all connected. But can you give me some more specific examples of how this mind-body connection plays out in real life?
Sure, let's talk about chronic pain, for example. We often think of pain as a purely physical sensation, but research shows that our thoughts, our emotions, our beliefs, they can actually amplify or reduce our experience of pain.
So two people could have the same level of tissue damage, the same injury, but their experience of pain could be totally different depending on their mindset?
Exactly.
Yeah.
And that's where the power of the mind comes in. Mindfulness practices, relaxation techniques, even cognitive behavioral therapy can help people manage chronic pain by changing how they perceive and respond to those pain signals.
This reminds me of the placebo effect. It's a classic example of how powerful our beliefs can be, how they can actually influence our physical experiences.
It is. And it's not just limited to pain. Research has shown that the placebo effect can influence a whole range of conditions, from allergies to Parkinson's disease. It really highlights just how powerful our minds can be.
That's pretty mind-blowing. But this also makes me wonder about the flip side. If our beliefs can make us feel better, can our mental state actually make us physically sick?
It absolutely can. Chronic stress, for example, anxiety, depression, they've all been linked to a wide range of physical health problems. We're talking about things like heart disease, stroke, autoimmune disorders, even some types of cancer.
Wow, so it's not just about feeling bad emotionally. These mental health conditions can actually have a real measurable impact on our physical well-being.
Exactly. And that's why it's so important to prioritize mental health care. It's not a luxury, it's an essential part of overall health and well-being.
Well said. This whole conversation is making me rethink the very concept of health. It's not just about the absence of disease, it's about a state of complete physical, mental, and social well-being.
Couldn't agree more. That holistic view of health is becoming more and more important as we learn more about the mind-body connection and just how intertwined everything is.
This deep dive has really highlighted how interconnected everything is. Our biology, our psychology, our social environment, our culture, it all comes together to shape our mental health.
You've summed it up beautifully. And I think that holistic perspective is going to be crucial as we move forward, trying to understand, treat, and prevent mental illness.
This has been such a thought-provoking conversation. We've covered so much ground, from the history of how we classify mental illness, to the complexities of diagnosis, to the exciting future of treatment and prevention. It's been an incredible journey.
It has. But, we've only just scratched the surface. This field is constantly evolving, and there's always more to learn and explore.
That's what makes it so fascinating. So, what are some of the key areas of research that you think are shaping the future of mental health care? Where are we headed in terms of treatment and prevention?
Well, get ready for a glimpse into the cutting edge of mental health research. We're on the cusp of some pretty amazing discoveries that have the potential to revolutionize the way we diagnose, treat, and even prevent mental illness. And one area that's particularly promising is the development of new, more targeted medications. Well, get ready for a glimpse into the cutting edge of mental health research. We're on the cusp of some pretty amazing discoveries that have the potential to revolutionize the way we diagnose, treat, and even prevent mental illness. And one area that's particularly promising is the development of new, more targeted medications.
Targeted medications, huh? What makes them different from the medications that we have now?
Imagine medications that work on very specific neurotransmitter systems, or that even target specific genes that we know are involved in mental illness.
So instead of just treating symptoms in a broad way, these new medications could actually address the underlying biological mechanisms that are causing those symptoms.
Exactly. It's about moving towards personalized medicine, tailoring treatments to each individual's unique biological and genetic makeup.
This is making my sci-fi loving heart very happy. It sounds like the future of medicine is becoming a reality.
It really is. And this personalized approach isn't just limited to medications. There's a lot of interest in using brain imaging techniques like fMRI to personalize treatments too.
So we can actually see how someone's brain is responding to different therapies in real time, and then use that information to adjust the treatment so it's more effective.
That's the idea. It's about moving beyond trial and error and towards a more precise and effective approach to treatment. And brain imaging isn't the only exciting technology on the horizon. Artificial intelligence, or AI, is also making huge waves in the field of mental health.
AI, really? That's fascinating. I can see how AI could be incredibly helpful in analyzing vast amounts of data, like identifying patterns that we humans might miss, and even predicting how an individual might respond to a particular treatment.
You're exactly right. Imagine an AI system that could take all the information we have about a person, their genetic profile, their brain scans, their clinical history, and then use that information to recommend the most effective treatment for their specific situation.
Wow, it sounds like something out of a science fiction movie, but it's becoming increasingly possible with all the advancements in AI technology. What other potential applications of AI in mental health care are?
Well, think about the possibilities for early detection and prevention. AI could be used to analyze things like social media posts, text messages, and even voice recordings to identify individuals who might be at risk of developing mental health problems before they even show any obvious symptoms.
That's mind-blowing. So instead of waiting for people to reach a crisis point and reach out for help, we could use AI to proactively identify those who might be struggling and get them support early on. That could be a game changer.
I think so too. Early intervention is absolutely critical when it comes to mental health, and AI could be a powerful tool to help us achieve that. And it's not just about detection and prevention. AI could also be used to create more personalized and engaging forms of therapy. Imagine virtual reality simulations that allow you to practice coping skills for anxiety or depression in a safe, controlled environment. Or even chatbot companions that can provide support and encouragement between therapy sessions.
That's amazing. It's like having a virtual therapist available 24/7. But I have to admit, all this talk about technology and mental health care also makes me a little bit uneasy. It's exciting, but it also raises some ethical concerns, right?
You're absolutely right to bring that up. Whenever we introduce new technologies, especially in sensitive areas like healthcare, we have to be very careful. We need to be thinking about things like data privacy, potential biases in algorithms, and making sure that technology is used to enhance human connection and empathy, not replace it. We don't want to create a world where people are just interacting with machines and losing that human touch, that personal connection that's so vital to healing and recovery.
You've hit the nail on the head. It's all about finding that balance, isn't it? Embracing innovation, but making sure that we're always prioritizing compassion and that human element in mental health care.
Couldn't have said it better myself. And I'm optimistic that we can find that balance. The future of mental health care is full of potential, and I'm excited to see how all these breakthroughs and innovations will help improve the lives of people who are struggling with mental health challenges.
Me too. This whole conversation has been incredibly eye-opening. I feel like I have a whole new understanding of the complexities and the incredible possibilities in the field of mental health.
I'm so glad to hear that, and I hope our listeners feel the same way.
We've covered so much ground today, from the history of psychiatric diagnosis, to the challenges we face, to the amazing potential of technology to transform mental health care. But as we wrap up this deep dive, what's the one key message you want our listeners to take away from our conversation?
If I had to sum it all up in one sentence, it would be this. You are not your diagnosis. A diagnosis is just a tool, a starting point for understanding and treatment, not a label that defines you as a person or dictates your future. And no matter what challenges you're facing, remember that there is always hope, there is help available, and you are not alone.
That's a beautiful and powerful message. Thank you for sharing that. And thank you for joining us today on this deep dive into the fascinating world of psychiatric diagnosis. It's been an honor to have this conversation with you.
The honor was all mine. And to our listeners, we encourage you to keep exploring, keep asking questions, and never give up hope.
Well said. That's all the time we have for today, but remember, the conversation doesn't end here. Stay curious, stay compassionate, and keep those aha moments coming.
Until next time, keep diving deep.